Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Siti Hamizah binti Abdul Halim. Today, our group would like to present the subject Information Services and Facilities, and the title is COVID-19 Impact on Malaysia Healthcare Sector. And I will respect to Dr. Fauzia binti Adleie as our lecturer. Before I proceed, this is our group member. This is me, Siti Hamizah binti Abdul Halim, 1181697. Noor Syahirah binti Nawi 1181696, Amira Nasuha binti Mohamad Rohizad 1181698, and Tuan Amalin Aisyah binti Tuan Adleie 1181702. Firstly, for the introduction of this topic, COVID-19 is the world's most serious healthcare problem in a century. COVID-19 has wreaked havoc on healthcare system in Malaysia and throughout the world. Pandemic, this contagion has indirectly affected not only the healthcare sector but various sectors in terms of security, economic and social. Several impacts of COVID-19 on the Malaysian healthcare sector have been discussed, including the challenge faced, problem or disruption encountered, alternative solution and suggestion and improvement.
Alright, our target group for this research are this research is suitable for everyone who is interested in current issues such as COVID-19 issues, especially to the community in Malaysia. In addition, this study is suitable for researchers who study in the healthcare sector as well as students who conducted researches on related issues to be their current guide and reference. Furthermore, this information is also provided to those who want to learn and get information resource about COVID-19 impact on Malaysian healthcare sectors.
Next, I will be continuing to the next part, which is justification. Our purpose in choosing this topic was to make it accessible to everyone, including all communities, employees, students, and researchers. Aside from that, this study provides to public understanding of the obstacle faced during COVID-19, as well as problem or interruption encounter, alternative solutions, suggestion, and improvement in the Malaysia healthcare industry. This study will make it easy for other researchers and readers to get information about the impact on Malaysia healthcare during COVID-19 outbreak. We also list various types of sources for each subtopic to make finding information on this topic easier.
Now, I will explain about the challenge faced by the healthcare sectors. Alright, in this part, I divided into three subtopics, which is the first one is inadequate supplies of medical equipment. The secondly is healthcare of staff, and the lastly is difficulty accessing limited health facilities. Alright, in the first subtopic, which is inadequate supply of medical equipment, I have provided three resources, which is one article, one journal, and one newspaper. Then I chose the article title, which is Medical Supplies Shortage in Asia, and for the title of the journal is COVID-19 Epidemic in Malaysia, Epidemic Progression, Challenges and Response. Alright, based on the resources, it can be said that the healthcare sector is struggling to meet the shortage of medical supplies with the increasing number of COVID-19 cases. Besides, it has been reported that oxygen tank and medical personnel are two critical factors required in the country to keep the healthcare system together as the country grapples with a surge in daily COVID-19 infection. Therefore, the frontliner in the country are appealing for additional funding to help them mitigate the outbreak. Next, on the subtopic of the healthcare of staff, it contains two journal and one newspaper resource. Which is the title of the journals are, the first one is depressive symptom among frontline and non-frontliner healthcare providers in response to the COVID-19 pandemic in Kelantan, Malaysia, a cross-sectional study. And the second one is the COVID-19 global pandemic and its impact on the mental health of nurses in Malaysia. So based on the resource, it can be stated that healthcare providers have a significant responsibility to combat the COVID-19 pandemic as they are on the front line in managing public health. However, the increasing number of infected patients make them highly vulnerable to experiencing physical, mental, and emotional exhaustion. This psychological burden, especially among frontline staff, may have an impact on their mental health, such as anxiety, depression, distress, sleep problem, and somatic symptoms. The last part in this topic is difficulty accessing the mental health facilities. In this subtopic, it contains one newspaper, one article, one website, and one journal resources. Alright, for the article, the title is COVID-19 in the Adleie Malaysian perspective. For the title of website, it have COVID-19 and healthcare. And for the journals, the title is Public and Private Sectors Collective Response to Combat COVID-19 in Malaysia. Alright, in this subtopic, it can be said that the resurgence of COVID-19 cases has overwhelmed the public healthcare system and overload the healthcare resources. Therefore, Ministry of Health has adopted an emergency ordinance to instruct private hospitals to receive both COVID-19 and non-COVID-19 patients to reduce the strain on public facilities. Besides, the treatment of COVID-19 patients at private hospitals could help to boost the bed and critical care occupancy. Then, Malaysia, like many other Asian countries, need to strengthen its healthcare system, particularly to mitigate the COVID-19 cases in the country. Hence, the public and private healthcare partnership must be enhanced and continue to find effective ways to collaborate further to combat the pandemic.
Assalamualaikum. I will talk about the second topic, which is problem or disruption encountered health sector during pandemic COVID-19. And in this topic also has 10 sources had been inserted in these directories, which is 2 sources from the online newspaper, 2 sources from article, 1 sources from article journal, 2 sources from dictionary, and the other 3 sources from website. And at this topic, I have divided into 3 subtopics, which is the first one, delay in the medical manufacture, second is lack of employee, and last one is high cost of treatment. For first subtopic, I found the sources from article that title is Understanding the Impact of COVID-19 on Essential Medicine Supply Chains, and also the website that title is Medical Additive Manufacturing. To be concluded to first subtopic, these sources discuss some of the obstacles in the global medication supply, which are severe supply chain block caused by significant decrease in air cargo capacity, sea freight, and transport logistics, and also exports restriction by supplier countries related to both COVID-specific commodities, but also non-COVID ones, and the slowdown in production of medicine in affected countries. This began in China with API production. Next, the second subtopic is lack of employee. Generally, I found sources for this topic from article and online newspaper. It can be concluded community care facilities showing continued decrease in employment, while other components have nearly recovered, and all health service industries had sharp drops in employment at the beginning of the pandemic. The last one subtopic is high cost of treatment and facilities. For this topic, I found the sources from journal and also the website. It can be concluded that healthcare sector covers how private providers are seeing fast cost increase due to infection control and personal protective equipment, which is PPE, and the high cost of medicine and COVID patient therapy. Next, I will pass to Syahirah.
The third topic on this research is alternative solution in dealing with COVID-19. There are 3 subtopics on this topic, which is the first, introduce COVID-19 vaccine, the second is cooperation between public and private hospital in dealing with COVID-19, and the last is follow the prevention action that have been suggested. In this topic also, 10 sources have been inserted in this directory, which is 3 sources from website, 4 sources from article, and 3 sources from journal articles. In the conclusion from the first topic, which is introduce COVID-19 vaccine, the healthcare system in Malaysia has been described since the outbreak of the COVID-19 pandemic and the discovery of the vaccine that respond to new post-pandemic realities through resilient recovery and new post-pandemic realities. Strong health systems are required for effective vaccine delivery. Nevertheless, Further, access to vaccination and better health system for developing countries will be much beyond the capacity and resources of international aid programs. Next, in the cooperation between public and private hospitals in dealing with COVID-19, the willingness of private medical consultants to assist in the management of COVID-19 patients is another key issue in the alternative option to address the effect of COVID-19 on the Malaysia healthcare sector through partnership between public and private hospitals. And the last but not least, in the conclusion from the source of follow the prevention action that have been suggested is discuss about the goals of social distancing are to avoid interaction with someone who has COVID-19 symptoms. Various types of measures to control or restrict people movement, distance or limit social contact, or restrict access to various social and healthcare facilities may have created particular difficult barriers to receiving social support or accessing healthcare and other supportive service in this situation.
The type of material this topic include 10 sources, which is 2 from website, 4 from journal article, 3 from newspaper and 1 from dictionary. And at this topic, I have divided into 4 subtopics, which is first, improve assessment of COVID-19 cases in primary healthcare facilities. Second, encourage the involvement of private medical practitioners in providing alternative CAPGP and private CSC services to COVID-19 patients. Third, expansion of virtual CSC nationwide. And lastly, automatic voice recording service, which is Robocall. For the first subtopic, which is improve assessment of COVID-19 cases in primary healthcare facilities, I have found 4 sources at this subtopic, and I will conclude that the sources explain about strong primary healthcare has the capacity to reduce this indirect effect during pandemic and also to reduce stress on the entire health system by providing comprehensive care and prevention. And also explain about the process of upgrading the services of the COVID-19 assessment, which is CAC. And for the second subtopic, I will conclude that the Ministry to mobilize private general practitioners GPS to deal with this COVID-19, and it is time we change the narrative to encourage fully voluntary community participation, and how public-private healthcare partnership must be enhanced and continue to find effective ways to work further to combat this epidemic. For the third subtopic, which is expansion of virtual nationwide, I have found 1 sources from website, and I will conclude that the establishment of 213 COVID-19 assessment center, which is CSC nationwide, to handle COVID patients undergoing home treatment, and the level of COVID-19 patient will be classified by the CSC to determine patient management. Lastly, for the fourth subtopic, which is automatic voice recording service or Robocall, I have found 2 sources from the newspaper and dictionary. I will conclude that SMS services and automatic voice recording or Robocall will be used for individuals experiencing symptoms such as fever, difficulty breathing, prolonged fatigue and chest pain. Anyone who experience a warning sign will receive a call from a virtual CSC, which is COVID-19 Clinical Evaluation Center.
In conclusion, the impact that healthcare sector throughout the world have faced during COVID-19 are mostly due to lack of readiness. For instance, PPE for healthcare professionals was insufficient supply in several cases. COVID-19's flaws have prompted healthcare organizations throughout the world to design new vital care for patients, which is encouraging. Alternative strategies including vaccinated, telemedicine, social distance, mask wearing, hand washing, and quarantine have all aided in reducing the consequence of the COVID-19 pandemic. That's all from us. Thank you.